while I look at this group, I've been talking to a few people who are patients here as well. And I just want to get a feeling for those who I'm talking with at this moment. How many of you here in the room either know someone with glaucoma or have glaucoma or a question of glaucoma? Wow. Okay. How many of you here know children and infants get glaucoma? Okay. Dr. Lambert, I expected that. Okay, and the other question or statement rather is that did you realize the percentage that is preventable for vision loss in both adults and children? Like 80% of vision loss, visual loss in all age groups across the board is preventable and treatable. That's an amazing number. So one of the things that is a little tough, you saw very few hands raised for pediatric glaucoma, and yet it's the leading cause of blindness in the world in children. It's amazing. I mean, honestly, it is very different than adult glaucoma. Oops, sorry about that. The incidence of pediatric glaucoma, I would say in the time that I was trained, and I was, pretty much always interested in glaucoma as a kind of chronic disease that was very similar to things I loved in internal medicine. But one of the things that just struck me was how everybody said this is uncommon and this is rare. And quite frankly, when you have a passion for something that is considered rare or uncommon, it's kind of a problem. So, I mean, I treat patients, as Dr. Goldberg said, with adult glaucoma. That's how I've been trained as a glaucoma specialist in adults. But my passion has really been for trying to change how we all view children with glaucoma, at least in ophthalmology, in the medical field, and in the world. And yet, it was really underrepresented when I first started out. So much so that when I said I really wanted to build a clinic, they said, well, we're going to give you some space. And no joke, it really was a broom closet. And they really did believe it wasn't an insult. They really believed that's all I would need for how uncommon the disease was. But then again, this was my passion. It's hard to change that. So one of the first questions I'm often asked is, how do you even know if a child has glaucoma? So those of you who raised your hands about you have glaucoma or someone you know does, you have an idea that it has something to do with intraocular pressure, right? I see a lot of heads. And the thing is in children, elevated intraocular pressure manifests itself in a different way. And it has to do with the unique time period that it presents. Anywhere from birth to 3 years of age, it is like a completely different set of symptoms. In adults, you don't see any change in the eye, do you? But everybody's looking at the optic nerve and the damage it might have. Well, in children, the eyes can either grow very large because of the elevated pressure. The cornea can become cloudy. The eyes are tearing, irritated. They don't like light. And quite frankly, at its latest stage, you can't miss it. You just can't miss it. So how do we treat it? Okay, so here's what was considered uncommon, and yet there was something about this that was very, very, very engaging to me. And that was that if we diagnose it early and we treat it appropriately, that child, if it is primary congenital glaucoma, stands a good 80 to 90% chance of having normal or near normal vision for the rest of their life. And if you don't, they're blind forever. So it's an all or nothing event, all or nothing. If that doesn't capture you as a physician who really has set their sights, so to speak, on preserving vision, I don't know what will. And it became very, very obvious that it was going to take a team to do this, that we were going to need to collaborate with people from all over the world in order to come up with those processes that would diagnose early and treat appropriately. So my team started off pretty small, and this is actually a big version of the team. Started off with about 5 people, physicians from all over the UK, the United States, some very, very notable people. And we started off by thinking, okay, we have an idea of what we think is the best things to do from our experience, and we're the ones doing a lot of these. Why don't we tell the world? And why don't we work with the rest of the world? So cutting to 8 years later, children's CGRN, the Childhood Glaucoma Research Network, was born, and we are now in every major eye center in the world and teaching the rest of the world. So does it matter? I mean, did we make any kind of impression on anyone? Well, the answer is, of course. I mean, if it was your grandchild or your child, you'd relate to that one case. But the fact of the matter is, with burden of disease, with quality of life, with so many parts that vision plays in education, economics, socioeconomic mobility, it makes a huge difference, whether it's in the United States or whether it's anywhere. So global impact of that became a big part of what we were doing. And we started to say, we need to figure out here in the US and everywhere else, how can we get these children? We can train the doctors how to treat, but how do we get the children in time to treat them? In the United States, vision screening is with the public school system. They're 7, 8. It's getting a bit late. And so using accessible technology and using an in-place healthcare system, and also with the support of some very, very generous people who have really the vision for children's future and what vision means to their education, have supported building this system. And I think we're making great progress. So now I'm here, and I want to build a center in Stanford. But why Stanford? It's obvious. I mean, honestly, the collaboration across disciplines, the whole name itself works to help us to create healthcare policies elsewhere. I don't really believe we should go in and only, do these clinics that come and go. No, we have to create healthcare policies where people recognize the importance of saving vision in children. So really, when you think about it, what I want to do is from that broom closet to the first pediatric glaucoma center that I built, I want to do more here. I want to create a center that is really towards visual impairment of all kinds in children, because early diagnosis makes the difference. So we're thinking bigger. Thanks to Dr. Goldberg. When I said what I wanted to do, he said, think bigger. I thought, wow, you betcha. Part of my life's in Minnesota. You betcha. And so that's what we did. And I've only been here a few months, and I will tell you, it's been definitely the right choice. These are our goals. Humbly, I state them because they look like they're, oh my gosh, a pie in the sky. But I can tell you, I've I've gotten that pie in the sky before. And the reward are the thankful children who you operate on at 2 weeks of age, who later draw you a picture with their eyesight with a condition that previously was routinely resulted in blindness. So I want to thank everybody here who supports this idea, and really want to thank my friends from the Caribbean who have really moved this project forward. Thank you for your time.